Hello, hello. Welcome back to lesson 4, where we're going to be discussing patient care in CT, which is one of the most vital lessons that you need as a new CT technologist. Now, the CT patient. So, patient assessment is probably one of the most important steps before beginning any type of CT exam. It doesn't matter what exam you're doing, it is the most important step. Okay, so to assess your patient and to make sure that they understand what exam they're going to have, if they are alert and oriented and are able to respond to your questions. So, and it's very critically important to obtain the proper clinical history if it's possible. Now, I know in CT, it can be a shit show and there's a lot of moving parts and a lot of things happening. So, the most important thing is if you can get proper clinical history so that your clinical history matches your orders and the patient confirms it, it makes a world of difference. Now, the other important thing is to review medications because there are certain medications that can contraindicate with contrast media. So, such as amiodarone, which I know I've gone back and forth with pharmacy, and so far it is safe to inject with contrast, but physicians will actually kind of monitor that. So that is something new, and I'm not 100% as far as the literature. So in a future lesson, I can probably offer you more information as far as that. So review of medications like metformin and any type of diabetic medications are very, very important. Okay, because a lot of times patients will have to stop taking their metformin after a contrast injection. Okay, if that does apply to your facility. Now, review of allergies, making sure the patients don't have contrast reactions or prior contrast reactions or any reaction to contrast media. Now, there is a lot of debate as far as in my hospital, as far as when it's listed, there's an iodine allergy. Now, 9 times out of 10, when we start questioning the patient, questioning the physicians, and they start asking the patient, a lot of times what happens is that they will go ahead and question the patient and notice it was a shellfish allergy, or they were allergic to contrast 30 years ago, but got contrast recently and nothing happened. Usually because we had ionic based contrast back then, and now we've switched to non ionic, which is a lower osmolar based contrast media. So it's important to kind of ask those questions, question your patient, make sure that you get appropriate allergy information. And then medical conditions. We got to make sure that, we review all the medical conditions for the patient, any prior exams, pregnancy for women, etc. Now, communication is key here, okay? Communicating with your patients, talking to them, making sure that they're comfortable so you can get an optimal exam. I can't tell you how many times texts do not explain exams thoroughly. It is very important that you do that. Now, patient education is also a very important piece. So, clear explanation in dummy terms that they can understand of the exam. If patients have questions, do your best to answer them. If you don't know, it's perfectly okay to say, I don't know. Let me find somebody who can get the answer for us. And then let them know the side effects of IV contrast and any post exam care. Like make sure they hydrate. If they take medications, make sure they take their medications to stop metformin for 2 days. Make sure that they get their labs redrawn, things like that. Now, patient immobilization. It's important to minimize patient movement during a CT scan. So, instructing the patients to hold still, using your straps, cushion, other devices can be used to make sure that we minimize the movement. Breathing instructions is also another method to reduce motion during CT imaging. So, if the exam calls for it to hold their breath, make sure you coach the patients, you instruct them when the voice is going to go on, and make sure they hold their breath for the exam so we can get a nice clean picture. All right. So that was a short episode. I'm just kind of giving you just some basic tools, okay, on how to navigate your CT training. So because in future lessons, I will be diving into a lot more detail. So this is the end of lesson 4. In lesson 5, we're going to talk about CT image acquisition and parameters. So I'll see you in lesson 5.